Group 5, we have to design a recreational program for the elderly living in a nursing home to promote mental wellness to stave depression. Okay, so I'm Cindy. So I'll talk about what is depression. Depression is classified as a mood disorder. It may be described as feelings of sadness, loss, or anger that interfere with person's everyday activities. It's considered a serious medical condition that can get worse without proper treatment. So I'll pass it to my friend to talk about how does depression affects people's life.
I'm Patrina and I will be talking about how depression affects people's life. Physically, patient might have weight gain or loss, chronic pain, heart disease, worsening of current chronic health conditions, trouble sleeping or oversleeping, self-mutilation, which also means self-harm. Mentally, the patient will also isolate him or herself, have suicide feelings or attempt on it, or suicide itself. It can also affect people around the patient, such family conflicts, relationship difficulties, and work or school problems. Next, I will pass on to the next person.
Okay. So these are the complications of depression in elderlies in nursing home. Therefore, answering the question of why is it important to stave off depression. First would be accelerate functional decline. So when the patient is experiencing depression, they are less likely to be active. They might isolate themselves and they might refuse to partake in their normal daily routine, and they might be less likely to be interested in their self-care. So they probably won't eat, they probably will refuse to eat, or they have loss of appetite, and they will refuse to take a bath or talk as much as they used to. And as they keep going in this manner, they will eventually lose the ability to do so, therefore accelerating functional decline. And they might have increase in complications due to the antidepressants that they will have to take due to depression. And as we know, most antidepressants will cause you to be drowsy. There might increase in falls and also loss of appetite and shakiness. So third would be increase in self-harm and suicide rate, as most depressed patients are highly likely to have intentions of suicide. And next would be non-compliance with medication or rehabilitation. So as they lack self-care, they might be more inclined to be non-compliant. And this can be made worse with their outbursts of mood. They might suddenly feel down, or they might suddenly feel aggressive, and they don't want to comply with the medication or rehabilitation that helps to keep them from like having functional decline. And also staff are likely to experience burnout because not all of the staffs in the nursing homes are trained psychiatric nurses. And as we know that most nursing homes in Singapore or hospitals in Singapore are usually very short-handed. Therefore, staff would probably experience more burnout as they have to take extra care for such patients and extra lookout for such patients. And if these patients do get depression, then they might have to take extra medication and probably extra activities, and these might cause additional costs for their family to pay for them each month. Yes, so thank you.
Okay, thank you, Nasra. So now I will continue with the recreational program. Our group has come up with two activities. The first one will be sing and share, and the second one is fantastic drawing. For the first activity, the name of it is sing and share, so it might be something that related to music. So we can gather the elderly who love singing and enjoy music. After that, we can start breaking the ice because some of them may not know each other very well. So we can ask them to like introduce their name or share about their hobby or the types of music, such as their favorite singers, their favorite bands, or even some particular song or the era of music that they love. And after that, we can divide the participant into groups according to the types of music. Each group will then pick their most favorite song and choose a member to sing it to everybody. And after the performance, each group members may share their memory about the song, such as how special is it to them. And lastly, The end of the activity will be about choosing the best singer, and the chosen one can be the host for the next activity while everybody is having like snake together. And the second activity is about fantastic drawing. So elderly who is interested in drawing can join the activity. So the participant can choose the topic that they want to draw, and by that the different groups can be formed. And each group members can decide how they want to draw their own masterpiece. And the greatest drawing will be selected by the group members, and the chosen drawing will be distributed to other group like randomly. And lastly, each group will take turn to describe what the drawing they have. And other groups will guess the drawing while having the light snake together. And that is when the activity will end. Thank you. And now I will pass the time to Wei Lu.
How does the program help? Patients can choose which activities they want to do according to their own preference or body condition. Singing and dancing is a good choice. Singing and dancing is a form of relax, acting as an outlet for someone's emotion. Singing can decrease symptoms of anxiety, stress, and depression. Group singing together, singing with your friend can help to build confidence, self-esteem, and tolerance. If the patient don't like to do exercise, don't like singing and dancing, maybe you can suggest them to draw. Drawing is a form of expression and communication. Drawing helps people to make a sense of their own work. As if we draw, we can concentrate on what we want to communicate. On the other hand, it helps to distract from problematic or stressful situations.